Hi, it's the Nursing Professor. Today we're actually going to take a further look at assessment, and we're going to talk about the various assessment techniques you should be familiar with. So first would be the various types of precautions that we need to be aware of. First one is standard precautions. Standard precautions means that you're treating everybody as though they're potentially infected. So we don't care what you look like. We don't care what anything says. We're going in that room and we're going to treat you as though you're potentially infected, which means when we come in contact with blood or body fluid, we are prepared. All right. Gloves in particular. All right. If we're taking care of somebody who's on airborne precautions, frequently that's going to be someone who may be having a possibility of having TB. TB is a bigger organism. So we want to make sure that we're protected from that. We wear what's called an N95, which is a specialized mask in which you are fitted for. You put that on. It must fit in order for you to have a proper protection. All right. We also have airborne, where we can wear a surgical mask for those patients. Those would be people who have like colds and flus, things like that. All right. We also have contact precautions, meaning that anywhere we touch on that person, then we're going to make sure that we have on gloves. And always remember this, gloves are not a substitution for not washing your hands. You still must wash your hands every time you take off those gloves. All right. All right, so those are pretty much the precautions. Of course, there are other specialized ones like enteric precautions. Those would be people who may have contaminated stool, and those types of things we'll go in a little bit further when we go into the chapter on infection control. Now, it's important for you to know how to don and doff PPE. Donning PPE means that you're putting it on. Doffing means that you're taking it off. So the order in which to don PPE is putting on your gown first, your mask, your goggles, and finally your gloves. All right. Doffing PPE is more important because at that point you have been contaminated. You probably had touched something in that room. And so the first thing you want to do is to remove your gloves. I always say the best way to remember this is think of that you got boo-boo or vomitus or something on your hands. You're not going to take that gloved hand and touch yourself to remove your gown or to take off your mask. You're not going to do that. You're going to remove those gloves first, so at least you have that stuff taken off. And then you're going to go to your goggles, your mask, and last your gown. When you take off your gown should be rolled outward and then tossed away. PPE is only used for one person. It's not shared between patients. The idea is to protect patients from getting a disease that another person has, an infectious disease. It also is to protect us from carrying those types of infections home or getting ourselves infected as well. All right. Moving on, there are some standard positions that you should know. Supine. Supine means that person is lying on their back. Prone means that person is lying on their stomach. Lateral means that person is lying on their side. And Sims means that person is lying on their left side with the right knee over the bottom leg, which is the left leg. Sims position is frequently used for things like administering enemas, doing a rectal temperature, sometimes in various maternity procedures that you have to do. Fowlers is also important. When you're feeding people or people are eating in bed, they should be sitting upright as much as possible. That's called Fowlers or high Fowlers if they're able to sit straight up. You also have semi-filers when a person cannot sit straight up, but their head is somewhat up. So remember and know what those procedures are because frequently they are a part of a test question. And if you can't recognize what position a person is in, you definitely can't figure out the rest of the question. All right. Okay. Moving along with our assessment techniques, we want to look at 4. First one, inspection. Inspection is where we're using our eyes. We're looking. We're looking to see if there's any abnormality. All right. We're using things like adequate lighting, because if you have a dark room, you can't see what's looking abnormal on your patient. So you want to have adequate lighting. You want to use tools like a pen light. You would use an otoscope, which is the device that has a light on it that goes in a person's ear. You would use an ophthalmoscope, which is the instrument that has a light on it that goes to examine the person's eyes. All right. Moving on, we have palpation, which is our hands, especially our fingertips. We move around that person's body by touch, and we should be able to feel things that are abnormal, like if there are any lumps or bumps that should not be there. We can also feel something called crepitus. Crepitus is when you literally have these little air pockets up underneath the skin. They almost feel like bubble wrap, and that's not normal. And so you actually should be able to feel for those. All right. Vibrations is something else that you can actually feel with your hands. Percussion. Percussion is, you should use a glove for one, and you use one hand on the person and you use the other hand to kind of tap. And that sound should give you some idea as to what's actually happening with that patient. It's not used as frequently as you may think, but the best place to learn that is in the lab, because it's pretty hard to describe, but know that that is possible. And auscultation. Auscultation is the last one that we're talking about, and that's where you use your stethoscope. Your stethoscope has two sides. It has a bell and a diaphragm. The diaphragm is actually used best to hear high-pitched sounds. And so that's going to be your bowel sounds and your respiratory sounds. The actual smaller size of that device is called the bell. The bell is actually used for low-pitched sounds, more like heart murmurs, cardiovascular abnormalities can be heard with that. But using a stethoscope really does take practice. So all of these things in health assessment, we can talk about them till we're blue in the face. But the truth is, you have to practice, and practice on different people, practice on your family members in order to be able to tell what's normal and what's not so normal. All right. So don't just wear that stethoscope around your neck or have it hanging from your rear view mirror because you want everybody to know that you're in nursing school. That's not enough. You need to put that stethoscope to work. Oh, one more thing. Want to remind you of this. If you're listening for sounds in the abdomen, your bowel sounds, you should not wake things up before you do that. And so the order is a little bit different. So you would inspect it first, then you would auscultate, and then you can start your actual palpation and percussion. Okay, but everything else should be inspection, palpation, percussion, auscultation. But when you're listening to the belly sounds or bowel sounds, then you don't want to wake things up first. You want to listen. You want to inspect first. You want to listen. And then you want to percuss and palpate. All right. So I hope that helps. I will see you on next video where we'll continue to talk about assessment. This is one of the most important tools that you need to master in order to be the best nurse you possibly can be. Please like and share. See you next video. Bye for now.